gosh, y'all. Thank you so much for tuning into this week's episode of the Eating Me podcast. This is Alicia, and I'm really excited because I have my chiropractor here on the podcast. And
Hello.
when I asked her to come on the podcast, I think initially she was a little nervous, but I told her, I was like, listen, this is going to be a great opportunity just for us to, like, I can learn more about you. And then
Yes.
for other people to, like, just learn about chiropractic care in general, because I've actually been going to the chiropractor since, I would say maybe since I was like 10 years old, maybe
Okay.
even before that, because I had really bad asthma growing up. And so
Okay.
that's how I started in the whole chiropractic world. So you guys, thank you for tuning in, like I said, and let's welcome Dr. Cosey or Yasmin Cosey
Yes.
to the podcast. Thank you so much for being here.
Thank you for having me. Hello.
Yes, I'm so happy you were here. So, like with any person that's like, on here, especially when we're talking about their profession, what was the thing that got you into chiropractic care?
Yeah, so as a kid, I was around maybe like 5, 6. I actually fractured my femur.
Uh-huh.
So originally, I did want to be an orthopedic surgeon.
Uh-huh.
So I did like have to have corrective surgeries, and I developed a relationship with my orthopedic. But then I also started going to a chiropractor in the midst of that, just to
Uh-huh.
help with like gait balancing. And I've been going to like physical therapists in the past too. But
Mhm.
I was very like impressed how chiropractic was like a non-invasive way of helping gauge building muscle strength and just helping you like to be able to connect with your body. Because I feel
Yeah.
like chiropractic is definitely a great tool, but it's also a different gateway to help you be like more aware of like what other things you need to fix as well in your body. So that started my journey with that. Yes.
Oh, okay, that is so cool.
Yes.
And it's funny because I think with just some folks when it comes to chiropractic care, like it's just not really, and I think it's becoming a bit more mainstream now.
Yes,
I
it's
mean,
definitely become more mainstream and people are becoming more aware of just like incorporating different wellness tools like to help with more preventative care.
mhm.
So it's definitely becoming more mainstream.
Yeah.
Yes.
And I think also, before I even go there with the whole thing, just with you going into chiropractic care, like the education component of it, because some
Yes.
people might be interested in that. It's like, what does that look like? Is it,
Yes.
a similar track as like like traditional MD? Like, what does that look like?
Yeah, it's definitely we have a lot of coursework, classwork. So basically I did pre-med LSU
Uh huh.
biology for 4 years and then I went to chiro school for 4 years. But we
Uh
learned a lot of anatomy, different things about the nervous system, philosophy. So
huh.
it's
Uh huh.
definitely a good program and we do have a lot of coursework. Yes.
Okay. Yeah,
Because
because I was.
I feel like some people think chiropractic we don't learn like the whole body, but we're basically dealing with your nervous system.
Right,
Yes.
right. Which, and I thank you so much for pointing that out because we were talking yesterday. I went to the
Yes.
chiropractor yesterday, y'all. That's why I'm
Yes.
saying this. But we were talking about this yesterday, and I was like, I think a lot of people, like I said, it's gotten better with the mindset around chiropractic care. But
Yes.
growing up, a lot of people was kind of like, oh, this is like some mumbo jumbo type of
Yeah,
stuff.
it was
And
very yes.
right. And so it's important to know, like, this education is very strenuous, just like any other like health profession. And
Yeah.
so, and the fact that you have to be so focused and centered around the nervous system, that is,
Yes, it's
yeah.
definitely chiropractic has definitely paved the way just to, like I say, getting in alignment. And for generations, people have been getting their babies adjusted because
Hmm.
even the birthing process can be traumatic on a baby. So you definitely, because you're dealing with the nervous system. So it's definitely important from the time you're born to the time you go.
Yeah.
Yes.
And this is crazy because I've seen videos of like chiropractors, adjusting babies. And
Yes.
I didn't realize, I mean, when you think about it now, it's like, yeah, that is a very traumatic experience for the mom and for the baby because they're
Yes,
like,
exactly.
what is happening right now? You right?
Yes.
So I guess going to that, like when it comes to baby chiropractic care, are there particular, obviously there has to be a bit more specific techniques,
Yeah, so we do
right?
different techniques. It's definitely more of a low impact, low thrust. It's actually no thrust,
Uh huh.
and it's Webster technique that we do for babies that helps with like latch and colic, and or even if their range of motion is limited with birthing process.
Uh
So
huh.
it helps with that too. Yes.
That is so cool. Wow,
Yes.
that's crazy. Man, you know what? Actually, the video I saw, the mother was complaining about colic.
Yes.
And whatever adjustment the chiropractor did, they reported that things were getting better.
Yes,
as
exactly.
time went on. That is so
And even
fascinating
for
to me.
pregnant women, like,
Mhm.
chiropractic is good to help with breech babies, 'cause the
Mm.
yes, 'cause to make room for the baby in the womb as well, 'cause the round ligament get tight, lower back, so that helps, like, the baby to be able to move around to prevent breech babies.
Whoa, I didn't
I know.
wow. This is what I'm saying, like, this is
Yes,
crazy. So
yes,
I get also too, I didn't get the, opportunity to have a Maris, naturally. It was a C-section situation.
okay,
But I'm saying all that to say, for those women who have gone through C-section, is there and I mean, if it isn't, it isn't. But
yes.
would chiropractic care be something that could help with you possibly having a natural birth or if it or
Yeah, it
just your
definitely helps
uh,
with natural birth because it helps. Because the goal is you wanna keep the hips nice and easy and, like, more range
mhm,
of motion in the hips, and
right.
that's what basically limits the baby from having space when the hips are tight. So,
Mm.
chiropractic care helps with that range of motion and just giving the baby more space. It helps with the nervous system, relaxation techniques as well, so it does helps to, like, have a easier birth.
This is wild. I mean,
Yes.
obviously, I can't turn back the hands of time. It's almost
I
19
know.
years, but, like,
Yes.
who knew?
Yes,
I
exactly.
mean, you, but, like,
Yeah.
not me.
Yes.
That is wild.
Yes.
So, beyond that, like I had mentioned, I was going to a chiropractor when I was a kid for asthma, but pretty much and you can let me know. I feel like
Yeah,
there's so many things that can be either improved or I don't want to say alleviated, but that can
yeah,
definitely help a person with chiropractic care. Are there things that might not be like something that like say someone comes to you for whatever, you're like, yeah, we can't do that. Does that make
as
sense?
long as you have a spine, you can see a chiropractor.
Okay.
Yes,
Okay.
'cause that's your powerhouse. We may not be able to do the same techniques as far as, like, anything that like, let's say you're a more geriatric, right? So I
Yeah.
wouldn't do the same technique I would do with someone that's fine, that's could be a potential a little bit more hydrated as well,
Okay.
just to prevent fractures, but it still helps, like, with range of motion, blood flow as well, and so basically when the spine is misaligned, that's when you get all those other things that causes disease. So it is
Mm,
more like we do try to have it more of a preventative tool, but if it
right.
is a case where it's more of a treatment, we definitely assist with that as well. So anyone can receive chiropractic.
Oh,
Yeah.
okay.
Obviously, we refer out when we,
Mhm.
need to, and we work with other specialists. So we're not saying we could like fix everything, but it's
Right.
definitely good for more of an integrative approach as well.
Okay, that's pretty
Yes.
cool. I know
Yes.
at one point you were sharing with me that you also work in functional medicine, correct?
Yes, I do.
So can you explain to folks um functional medicine and then at some point I guess
Yeah.
also kind of like really give like maybe a down and dirty of just chiropractic care in general as well cuz some people might have certain, preconceived notions of what they think chiropractic care is.
Yes.
But,
Okay.
yeah.
Yeah, for sure. So functional medicine is more of a comprehensive program because
Uh-huh.
every individual, like the program should be tailored to that patient's need. It can be like something patients didn't know they're not getting enough sleep, their
Uh-huh.
mindset, like vitamins. So we will work with like a medical doctor as well, just for different blood panels to
Mhm.
see like what you're lacking. So it's more the approach is a little different. The actually, the visit is longer because we need
Mhm.
to get, like, an in-depth history because it's not only affecting, like it's like their whole lifestyle, it's more of a well-being situation with
Right.
functional medicine, and then how it shows up into the body. So, the adjustment will help to, like, release that tension as well. But we
Mm.
try to address everything, like, before it shows up into the body, when it shows up into the body, and how you can go forward with it.
Okay, that
Yes.
is so cool. And
Yes.
then also just like I said, in terms of just chiropractic, like just like a basic like understanding of it, because I know and you can let me know about this too.
Yes.
I a previous chiropractor I went to, I would always say to him, "Oh, I need this cracked or that cracked," and he's like, "Do not say cracked. It's
No,
adjusted."
it's adjustment and the subluxations that you have.
Okay.
Yes. I wish I had a spine with me.
No, and it was
Yes.
just so funny because I was just like, "Oh, I guess I shouldn't," and I guess for that type of with you saying like a cracking, right?
Yes.
I think I understand why you wouldn't say that, but because he
The
really didn't give me an explanation, if that makes
So
sense. You know what I'm
basically, the
saying?
cracking sound is lactic acid buildup between the joints. But like, if you want to get a true understanding of chiropractic, you wouldn't say cracking. So
Right.
basically, you coming in, you getting your nervous system assessed because your spine is where your nervous system lies, your arteries lies, right?
Right.
And then your muscles are attached from those areas. You have the insertions, the origin, the belly of the muscle, but
Uh-huh.
everything is kind of springing from that spine. So you can come in with pain, let's say cervical going into the shoulder, it can come from the TMJ, which all connects to the skull, the spine. So
Right.
basically, like to answer your question, you I'm trying to see, like, how I can help, like, a regular person understand.
Yeah. It's
So
okay.
you come in and, like, when you have, like, any misalignments, TMJ, that means, like, the vertebrae is out of place, and it's
Mm.
causing your body to compensate more in one area. So,
Right.
basically, the Kraken, which is the adjustment, is what's helping to, like, get that vertebrae back into alignment. So,
Okay.
basically, like I say, it's lactic acid buildup that's preventing the spine to have better range of motion. So the goal of the adjustment is to help you have better range of motion so oxygen can flow to those areas, the muscles, and the blood flow to the organs as well. And a
Okay.
lot of times, certain vertebrates, like if it's misaligned, it can also correlate to a system in your body, like digestive system, your heart too, as well.
Uh-huh.
So different areas can like kind of show up more based if you have like any lack in that particular region.
Okay. Thank you for
Yes.
breaking that down.
Yeah.
Because
So pretty much everything's connected.
right.
Yes.
But it was just funny because when he said that to me, I was just like, and then there was no explanation beyond it. But thank you for like really kind of like bringing that all together. Because
Yes.
I mean, I can say he wasn't upset or he's like, just don't say cracks.
Exact. Don't say crack.
I just didn't
Now you know
know.
you've been under chiropractic care for all your life. So yes, you're gonna
Right.
be an advocate as well.
Right. I had no idea.
Yes.
One thing I do I definitely appreciate, and you can if you can
Yeah.
explain more about this as well, the oh gosh, what are they called? Why am I blanking on it? The little suction cups.
Oh
Why am I blank
yes. Cupping?
cupping. Hello, Alicia.
Yes. Yes.
Cupping. Now is the actual I guess like idea of it is it just releasing muscle tension or
Yeah.
what is that?
Yeah, so cupping is just like another modality that we use as well
Okay.
to help incorporate with the adjustments. So basically, the purpose of cupping is to bring toxins to the surface. Because
Mm,
think about muscles like as a it's fascia, right? So think
right.
about like if your hair is tangled, use a comb to like tangle it, like get it out, right? So
Right.
basically, cupping is the same mechanism with your muscles. It helps to smooth out the fascia
Right.
along with another tool that we have called Graston. So those helps with like circulation, blood flow, and
Uh-huh.
you'll see the toxin rise like to the surface the more red or bruised that
Yeah.
it gets too. Yeah, so it's very important to drink water after cupping as well.
Right.
Yes.
Yeah, no, Dr. Cozy, every time we have, a session, she's like, "Do you have water?" And I'm like, "Yes, I got 'cause I always have
Yes,
water,
I'm a
like
water police.
but that's it's good though, you
Yes, I
know?
have my water.
Like, literally, you just never know, like,
Yes.
for me, I always have my water, but I think, because that's basically all I drink. I told y'all, it's
Yeah,
just water
exactly.
or kombucha for me. That's
Yes.
pretty that I'm pretty basic in that regard. But for folks who and that I'm glad we're talking about this, for folks who don't hydrate as often, um, is that causing more harm to their body as it relates to, like, even their skeletal, even nervous system? Like, what does that look like on that level?
Yes, for sure. So basically, your disc is made of water. Your
Right,
body is made of water. So it's just like a plant. If you don't water it, it dies.
right,
So the water helps, like, hike, even like if you're sweating a lot, it helps with muscle recovery. It
right,
helps with digestive system because if you have a sluggish digestive system, that's what also can like lead to more diseases, like having more mucus or yeast in your body, fungus
uh-huh,
in your body, which can be another culprit of a disease. So
right,
water is definitely important for like all your systems.
right.
Yes.
Thank you.
Yes. Yeah. So
Okay,
it's very important. So at least 64 ounces of room temperature water.
yes. That's the
Yes.
thing too, is like, I can't and this is just a personal thing for me, I
Yes.
can't drink cold water.
Okay.
It bothers my teeth. Like,
Okay. Okay.
And then also it
A
just
little
feels
s
weird in my body. I don't know if that ma
okay. Yeah, exactly, exactly.
I don't know.
Okay.
I don't know what that's
Okay.
about, but at least I listen, I'll take it because I know that's supposed to be like the best thing is the room temperature water,
Yes,
so I'm
it
okay.
is the best, yes.
I'm winning on that regard, thank God.
Okay, good.
No, seriously. So for someone who is pursuing like chiropractic care, like their first ever um experience in this type of setting, what would be something like they should either like prepare for, before that actual visit?
Honestly, I don't think it's because I do an in-depth history,
Mhm.
so and I'm very intuitive, like, as far as treating the patient, so if
Right.
they haven't been under chiropractic care, I walk them through I can feel what their body needs. If they are a little dehydrated, I do go lighter. So, basically, just wear comfortable clothes and show up. Yeah.
Nice,
Yes, and
nice.
if you don't have comfortable clothes, we have shorts too.
I love that. I love
Yes,
that.
yes,
So Dr. Kosi is located in Midtown here. Well, not Midtown, like around Herald Square, 34th
yes.
Street, here in the city. And I was so excited when found her. She actually found her on TikTok. There was
Thank
one of
you.
her patients filmed her experience in Dr. Kosi's office, and I was like, "Oh my gosh, I need to go to this chiropractor because one, I the chiropractor I was working with, it just wasn't not like in a bad way, it just wasn't
Yeah,
working out for the insurance pieces, blah blah whatever. And then I was excited because I was like, oh my gosh, this is a black woman
yes.
that is a chiropractor. What?
Yes, yes.
And so all that to
It's
say,
it's growing. More Black women are entering the field, so that's really good.
and that's literally what I was going to ask
Yes.
you. Like when you started in this profession, were there any black people in general in the actual class that you were a part of or anything like
Yeah,
that?
because over the time, chiropractic has definitely been more innovative. So it is a lot of like more Black women in the field. And
Mhm.
I have a colleague that actually has a website that hosts like different Black chiros around the world,
Oh,
just so they
nice.
can help like integrate that more into our communities if we
Right.
don't know. Because obviously, like just in our communities, like, we're growing for sure as a
Right.
people with healthcare, but the ones that don't know, like, chiropractic is just only, like, a fraction of what we really need to know as far as healthcare in most communities.
Right.
So, but yeah, it's definitely growing for sure.
Nice,
Yes,
nice.
yes.
And when you're just saying, like, just in terms of our community as a black community as a whole, do you find and maybe it's different here in the city,
Yes,
right? Because the city, like, we're just so much more diverse and we have more access. I think that's what
yes,
it is
yes,
too.
yes, yes.
Because I'm from Evansville, Indiana, and I did not experience that many black healthcare providers
Okay, yes,
where I was from. And was it different? Because so you guys know, Dr. Kosi is from Louisiana,
yes.
which I love because I
Thank
love New
you.
Orleans.
Yes,
Like
and I'm
I
from
gotta get
Baton
back.
Rouge, so yes,
Right.
yes,
And
see?
I've never been to So for Baton Rouge, and this is totally off the subject, but like
Yeah.
Baton Rouge, is it similar to New Orleans? And that's just my
No,
ignorance.
it's definitely a different, like, culture. I mean, we're
Right.
still Louisiana, but I feel like it's growing for sure. Yes.
Okay.
Yes.
Okay.
It's growing. New
I think it's
Orleans is way more creative, way like, history is much more richer, but yes.
right.
Yeah.
I think it's like when people think of New York City too, and they hear someone's from New York,
Yes.
but you don't know that they're not from the five boroughs. You're like,
Yeah,
oh my
exactly.
gosh, you're from New York, and they're like, actually, I'm from the middle of nowhere in New York.
But
But
Baton Rouge is the capital, so
right, she's like,
yeah.
hello,
Yes,
hello,
exactly.
we are the
Exactly, we're the
thing.
capital.
She's like, let it be known, New Orleans is its own thing. But no, I love it. I love it. No, no, no.
Yes,
But no,
but I love New Orleans, yes.
I love it. No, but I was saying that because I wasn't sure if in like Baton Rouge or even just in Louisiana in general, if there were more black healthcare providers, particularly chiropractors, where you're from.
I feel like honestly it's definitely growing.
Right.
I graduated chiropractic school in 2015. By that
Okay.
time, it's definitely has gotten like way more innovative and it's
Right.
definitely growing for sure. So I necessarily didn't really experience that disparity,
Uh-huh.
which is good. So
Right.
yeah, so like I can't really particularly speak on that one because I have
Right.
seen all types of cultures in our field now.
So
Yes.
that's
Which is
beautiful.
a
That
beautiful thing. Yes,
yes, it's
exactly.
beautiful
But I
because it's
know
like
the history of chiropractic. It wasn't that many of us.
right,
Yes.
right. Because the chiropractor that I went to previously, he was telling me he studied under. I don't know if this guy was like the original. I wouldn't say the
Chiro
original, but like he was like
He
one
went to
of the.
Palmer?
That sounds familiar.
Yes.
And he has his picture up in his office and everything. Like he was like,
Yes,
"No, this is the guy," and I was like,
yes.
"Oh,
Yeah, it
okay."
is. That's the guy.
And he was, white Italian American man that I used to go
Okay.
to, and obviously, is it Palmer, right?
Yes.
A white man. And
Yes.
so, and then when I was a kid, the chiropractor who went to my church, he was a white man.
Yes.
So all that to say, just coming back full circle, when I saw your face
Okay,
on
yes.
that video, I was like,
Yeah, I'm not saying like it's, every but it's definitely like I say, I have a lot of colleagues that has practices around the world and they're Black women too.
right.
So it's been beautiful to see.
Yeah, I'm
Yes.
telling you, you have no idea how excited I was to come
Yes.
to that first visit. I think because my daughter and Chris, my wife, we all go to Dr. Cosey. And
Yes.
so that first visit, it was actually Amaris and I, my daughter. I mean, I was like, we've got to be on time. Of course, we didn't get there on time. I was freaking out. I was like, we cannot be late. We can't be those people. And she was like, Mom,
Yeah.
chill, chill. Like,
I know I love her marriage. She's so sweet.
super
Yeah.
excited, super duper excited.
But I like the fact that even like it's just more women in our field too now, which is really
Yes.
good. Yes.
Yes, but
Yes.
that's the thing is, like, I've always just experienced male chiropractors,
Mhm.
and I'm not taking away from, the work that they do,
Yeah, for sure.
but it's nice to see, like, "Oh, okay, we're also out here, doing the thing, making it
Yes.
happen." I love that. It's
Yes.
wonderful, you
Yes.
know?
Exactly.
I love this. Oh my gosh.
Yes.
So, Dr. Cozy, before we thank you so much for this because this was awesome.
Yeah, for sure.
Thank you, thank you.
Thank you for having me.
You are welcome, but
Yes.
before we go, I wanted to ask you, if you can let folks know, one, where you're located and, like, any websites or anything like that, yeah, just take it away.
Yeah, so I'm located at 45 West 34th Street, and it's Suite 1111, New York, New York 1001. And my practice name is Voss Health and Wellness. Voss means vessel, so your body is a vessel for healing, and that's VAS. Yes. So we're all vessels, we're all portals, like just to share love and humanity. So, like I say, if you have a spine, I'm here for you.
I love that. See, now I didn't
Yes.
know that.
Yes.
The vessel thing. Oh,
Yes,
that's
and it's bosshealthandwellness.com.
I love that.
Mm,
I see it on my,
yes.
little receipts all the time. I'm like, yeah, boss. Yeah. Oh,
Yes,
that's even more beautiful. Aw,
yes,
Dr.
yes.
Cozy.
Thank
What?
you, yes.
I love that. Let me tell you something, y'all. When you go to Dr. Cozy's office, it smells amazing. It's
Well, thank
so
you.
nice in there. Like it really is.
Thank you, and I have
It
to give that thanks to my partner, she designed it, so yes,
I love that. No,
yes.
the smells, I'm always asking, then I forget, but like the different scents, it just smells so welcoming. It's just like, oh, I could be in here all day. And you can
Yes,
smell it walking down the
thank
hallways. Like I
you.
was like,
Yes,
oh, we're here. Thank you, God. Like I'm not because it gives
yes,
you that relief, that sense of relief.
exactly, yes,
And I love that.
yes.
It's
Thank
so
you,
nice. Oh,
thank
you are
you.
welcome.
We try
Thank you.
to appeal to all the senses in good ways.
No, you're doing a great
Yes.
job. So thank you
Thank
so much
you.
again.
Thank you so much.
You are welcome. And y'all, thank you for listening to this week's episode of the Eat Me podcast. I will see y'all next week. Thank you. This was
Thank you.
awesome.